Hello students. So today in the series of dissection videos of the upper limb, we will be discussing about a very important topic, that is the brachial plexus. Now before starting the topic, we should take a look at the few important muscles. Here this flat large muscle you are seeing, this is the pectoralis major. This pectoralis major, it has a large origin right from the clavicle, which the clavicular fibers originate. Then along the sternoclavicular joint, then from the lateral surface of the manubrium. Here you can see the junction between the manubrium and the body of the sternum. This pectoralis major then further continues its origin along the lateral margin of the sternum. So here you can see the muscle as a whole, the clavicular fibers and the other fibers, which are the sternocostal fibers, because they also have origin from the costal cartilages. Now, as I remove the pectoralis major, there is another smaller muscle beneath it known as the pectoralis minor. Now, students, the pectoralis minor is also known as the key muscle of the pectoral region. These two muscles, they are supplied by the medial and lateral pectoral nerves. Now, as I remove these muscles and having removed the fascia and other soft tissue, you can see the neurovascular structures. So these neurovascular structures, as I remove and see in the center, I find this large blood vessel, which is the axillary artery. Now, students, the cords of the brachial plexus, they are named according to their position to this axillary artery. So, lateral to the axillary artery, you have the lateral cord. This lateral cord, it gives rise to three important branches, that is the musculocutaneous nerve. This musculocutaneous nerve you can identify as it pierces a muscle known as the coracobrachialis immediately after its origin. After piercing the coracobrachialis, this nerve, it is going to supply the other muscles of the anterior compartment of the arm, that is the biceps brachii, the coracobrachialis, the brachialis, and finally it will further continue down as the lateral cutaneous nerve of the forearm. So that is the musculocutaneous. This nerve which you are seeing, this is the lateral root of the median nerve. You can see it is being joined by another nerve which is coming from the medial cord. That is the cord which is medial to the axillary artery. So from the medial cord you are getting the medial root. From the lateral cord you are getting the lateral root. And these two roots together, they will join and they form the median nerve. So here you can see how these two roots, they are joining. I have removed the fascia, that is the medial root. So together they join to form the median nerve. Now this median nerve, it is going to supply large number of muscles present in our forearm. Now moving on to the medial cord, that is the cord medial to the axillary artery. Here this nerve which I am showing you now, it is the lateral medial cutaneous nerve of the forearm. And this thick nerve, which now I am showing you, this is the ulnar nerve. So the medial cutaneous nerve, it is going to give the medial cutaneous supply to the forearm. Whereas the ulnar nerve, as we know, it is known as the musician's nerve, supplies most of the muscles of our hand. Okay. So what are other branches? Other branches apart from that are the medial pectoral nerve and the medial cutaneous nerve of the arm. Now, as I remove all the structures and look behind the axillary artery, so there you can see the axillary artery and behind you can see your venous nerve. So that is the nerve arising from the posterior cord of the brachial plexus. Posterior cord is the cord which is present behind or posterior to the axillary artery. From that, we have the large nerves coming, the axillary nerve and the radial nerve. So here, what you are seeing, it is the radial nerve. This will supply the muscles of the posterior compartment of arm and the forearm also. That's all today. Thank you.